The School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, some people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. So the keynote speaker will be Professor Yuku Simlayi, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, is of the very first set. He's currently a professor of epidemiology and public health with the Morehouse Medical School in the United States. At the opening ceremony, this opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Simlaye, Professor Ogaji, Professor Atomwafo, Professor Florence Ndoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. The School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. So the keynote speaker will be Professor Yuku Simlayi, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, is of the very first set. He's currently a professor of epidemiology and public health with the Morehouse Medical School in the United States. At the opening ceremony. This opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Similaye, Professor Gaji, Professor Atomwafo, Professor Florence Ndoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. You know, the School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, some people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. So the keynote speaker will be Professor Yuku Simlayi, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, is of the very first set. He's currently a professor of epidemiology and public health at with the Morehouse Medical School in the United States. At the opening ceremony, this opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Similaye, Professor Gaji, Professor Atomwafo, Professor Florence Ndoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. You know, the School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, some people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. So the keynote speaker will be Professor Yuku Simlayi, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, he's of the very first set. He's currently a professor of epidemiology and public health with the Morehouse Medical School in the United States. At the opening ceremony, this opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Simlaye, Professor Gaji, Professor Atomwafo, Professor Flores Indoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. The School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, some people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. So the keynote speaker will be Professor Yuku Simlayi, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, he's of the very first set. He's currently a professor of epidemiology and public health with the Morehouse Medical School in the United States. At the opening ceremony, this opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Simlaye, Professor Gaji, Professor Atomwafo, Professor Flores Indoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. The School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025 is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, some people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. The keynote speaker will be Professor Yuku Simlaye, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, is of the very first set. He's currently a professor of epidemiology and public health with the Morehouse Medical School in the United States. At the opening ceremony, this opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Simlaye, Professor Gaji, Professor Atomwafo, Professor Florence Ndoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. You know, the School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, some people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. The keynote speaker will be Professor Yuku Simlaye, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, is of the very first set. He's currently a professor of epidemiology and public health with the Morehouse Medical School in the United States. At the opening ceremony, this opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Similaye, Professor Ogaji, Professor Atomafo, Professor Flores Indoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. You know, the School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially the doctoral students. Interestingly, this conference has been shadowed over 13 days. In fact, some people complain they have not seen such, but the School of Public Health is large. It has 13 different programs, and we have dedicated a day for each of these programs. And that's why this conference is spanning 13 days. The first day is basically an opening ceremony. There will also be a lecture, and the theme is translational research for national development and for service delivery. The keynote speaker will be Professor Yuku Simlayi, the immediate past DVC R&D of the university. The chairman of the occasion, the opening ceremony, is Professor Chima Onwebunwa, who an alumnus of the university. In fact, is of the very first set. He's currently a professor of epidemiology and public health with the Morehouse Medical School in the United States. At the opening ceremony, this opening ceremony will also provide us the opportunity to formally present the awards to the awardees. We have said that starting the Vice Chancellor of the University, Professor Owunari Abraham Goodwill, without his support and encouragement, and I must also say shield and defense, it would have been difficult for us to achieve what we have. Other award winners include Professor Similaye, Professor Ogaji, Professor Atomafo, Professor Flores Indoka, and then there are some staff like the Pioneer Admin Secretary and some service providers that have also aided our progress. You know, the School of Public Health, since we are the first, the pioneer in the country, we want to set standards, especially academic standards. And one of such is this annual scientific conference, which we have shadowed for the last 2 weeks of September 2025, is designed to showcase research works of our students, and of course to also give them the opportunity, a sheltered opportunity to make academic presentations, especially
So I will start with start all right.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign fatherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. Oh God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
University of Ibadan.
Nigeria. On the green lowlands and swampy plains of the New Calabar River stands the University of Port Harcourt, a citadel of learning and excellent education, a home of academic enthusiasts, searching for knowledge and wisdom, enlightenment and self-reliance on mission. Our hope in the future is rooted in God. The vision of our fathers shining in the skies, opportunities unlimited and equal. Our progeny citizens of the universe, from far and near, the pride of Uniport, because Uniport,
Thank you very much. So once again, you're welcome to the first annual scientific conference of the University of Ibadan School of Public Health. This is a virtual conference, and I would like you to take note of some of the following etiquettes so we can have a very hitch-free and very importantly, memorial etiquette. So before joining this conference, we advise you check your technology and join with a computer, and you minimize your distractions as much as possible, such as phone calls, ensure that service, like to Wi-Fi, use a modem. Confirm your camera So within the conference today, I would like you to mute your microphone. Stay focused. Please give every proceeding here full focus. Avoid multitasking. And also turn on your video. Also, video helps us know that you're here. And it also keeps you focused throughout the proceedings. So you're advised to turn off your video, however, if you're distracted, where you can really show us where you are. So you're required to turn off your video, not turn on your video when you're speaking. So please ensure you're properly dressed and also contribute thoughtfully. The Zoom platform has a raise hand feature. You could see it by the right-hand side of your taskbar. So you could indicate your desire when you want to speak and we'll give you audience. Then use more of the Zoom platform chat feature for relevant contribution. So please be respectful, maintain professionalism. Thank you for your understanding. All right, so my job here is simple. I'm going to establish the protocol or to kick off this program. So please take attention to the protocol for our presenters and all that. So the Vice Chancellor, Professor Unari Abraham Goodwill, the Chairman of the opening ceremony, Prof. Chima Ohabonwa, the keynote speaker and immediate past Deputy Vice Chancellor, Research and R&D of our university, Prof. Iyopu Simnealai, recipient of the School of Public Health Good Award, the members of the Governing Council of the university, our amiable DVCs, the DVC for Research and Development, DVC Administration, DVC Academics, all are distinguished medical and dental practitioners. The Chief Medical Director of the University of Port Harcourt Teaching Hospital, Professor Henry A. Uboma, the Chairman, Medical Advisory Committee of the University of Port Harcourt Teaching Hospital, St. Mark, Prof. Dennis Alasia, the Registrar, Dr. Mrs. Gloria Chinda, other principal officers of the university, the Acting Provost of the College of Health Sciences, Prof. Ngozi Okeke, the Dean of Graduate School, Prof. Kinikanwa Nele, the Dean of Faculties, Directors of Institutions and Institutes and Centers, the Registrars of Health Professionals Registration Board, the Registrar of the Community Health Practitioners Registration Board, and the Registrar of the Health Records Officers Registration Board. Also, the President of the Professional Association in Public Health, distinguished guests, professors, lecturers, supervisors of the University of Port Harcourt School of Public Health, our management and staff of the University of Port Harcourt School of Public Health, colleagues and students of the University of Port Harcourt School of Public Health, ladies and gentlemen. I welcome you all. I say thank you for attending. We will have a good time here, and this will translate into development of our sector, the public health sector, for the good of our land. So thank you very much. I'll quickly call on our director, our performing director, for his welcome address, Professor Best Odinioha. Welcome, sir.
Thank you very much. Let me just first apologize for starting a little bit late. I think it has to do with confusion over the start time. We thought 9 a.m. was early, but a lot of you joined even earlier than that, including our distinguished Vice Chancellor and Chief Host. So apologies for that confusion. Let me start my welcome address. The address presented by me, Professor Best Odinioha, at the opening ceremony of the first scientific conference of the University of Port Harcourt School of Public Health, holding virtually from Monday 15th to Tuesday 30th September 2025. The Vice Chancellor, sir, Professor Unari Abraham Goodwill, my Lord, spiritual and temporal, and the recipient of the School of Public Health highest award, the University of Port Harcourt Platinum Award, the chairman of the occasion, and a 1990 graduate of the University of Port Harcourt Medical School, Professor Chima Onwabunwa, Professor of Global Health and Epidemiology at the Morehouse School of Medicine, Atlanta, Georgia. I'm sure that if he hasn't joined, but he will join us later. The keynote speaker and the immediate past DVC R&D of our university, Professor Iyopu Similaye, all the recipients of the School of Public Health Gold Award, members of the Governing Council of the university, the DVCs of the university, Professor Nyaso, Professor Ogu, Professor Angela Frank Briggs, the Chief Medical Director of the University of Port Harcourt Teaching Hospital, my brother, Professor Henry Oboma. I'm sure he will join us later if he hasn't joined yet. The Chairman Medical Advisory Committee of the Teaching Hospital, Professor Dennis Alasia, Registrar of our institution, Dr. Mrs. Gloria Chinda, and other principal officers of the university, the acting provost of the College of Health Sciences, Professor Ngozi Ekeke, Dean of the Graduate School, Professor Kinikanwo Alnele, Deans of faculties. I want to especially recognize the Dean of my faculty, Faculty of Clinical Sciences, Professor Macklin Akpa, and Professor Reverend Father Walter Ihejrika, the Dean of the Faculty of Media and Communication Studies, directors of institutes and centers. I want to specifically recognize the center leader of the African Center of Excellence for Public Health and Toxicological Research, Professor Gaji, another recipient of the School of Public Health Gold Award, registrars of health professional registration boards, especially the registrar of the Community Health Practitioner Registration Board and the registrar of the Health Records Officers Registration Board, presidents of professional associations in public health. I want to specifically recognize the president of Association of Public Health Physicians of Nigeria, Dr. Kenneth Tafa, and the incoming president of the Association of the Society for Public Health Professionals of Nigeria, Professor Steve Rabba. Distinguished guests, I want to especially recognize Dr. Wisdom Sawyer, MNI, the head of the Civil Service of Bayelsa State, Professor Seifa Brizipe, the Bayelsa State Commissioner of Health, and Dr. Adeze Ore, the 27th Commissioner for Health of Rivers State. Head of departments, both in the hospital and in university. I want to especially recognize my HOD, Professor Omosibe Madoka, professors, supervisors, and lecturers of the School of Public Health. Let me especially recognize Professor Alex Nte, my mentor right from the medical school days, and of course the past and present lecturers in the Department of Preventive and Social Medicine, especially Dr. Labere and Dr. Moore, management and staff of the University of Port Harcourt School of Public Health, colleagues, students, ladies and gentlemen. It is with great honor that I welcome you all to the first annual scientific conference of the School of Public Health. This conference is organized to discuss postgraduate education in public health and the allied health sciences, and to showcase the health studies of students and faculty of our school. The School of Public Health was established in January 2019 by the Senate of our great unique university as a semi-autonomous academic center to provide postgraduate education in public health and the allied health sciences. The semi-autonomy of the school gives it the power to set and collect fees and to run its programs with the fees collected. So this gave it the power or the power to recruit and pay ad hoc lecturers from within and outside the university and from the industry to lecture in its academic program. So this gives the school an edge over the other universities in the country in the recruitment of the rich talent in NGOs, private and public organizations in Nigeria, ensuring that it has one of the best faculties in the country. So the school started with 4 academic programs, but currently runs 3 PGD programs, 10 master's program, a doctor or public health program, and PhD programs in all the subspecialties of public health and the allied sciences. Academic programs in the University of Port Harcourt School of Public Health are deliberately designed to be both academic and professional, to sharpen the research skills of students and prepare them for a career in the academics by emphasizing the practical skills that are needed for professional work. The results of these have been very remarkable, as the graduates of our various programs often secure employment few months after graduation, even before we could get their certificates ready. And they are also known to perform much better than the others. Much better than the others. So once you have the certificates from, of course, awarded by the university, you are sure that you will get employment once you present it. So the academic component of our programs, academic program of our program is particularly strong, with emphasis on translational research, especially as the students are supervised not only by academicians in universities, but also by industry experts in public and private sector. This emphasis on translational research will be reiterated in the keynote address to be delivered by Professor Similaye, titled Translational Research for Improved Service Delivery and National Development. The abstracts of more than 200 studies carried out by our students will be presented during this conference. The School of Public Health also has 2 academic programs to help publicize the findings of the research studies of our students. The Port Harcourt Journal of Public Health and the West African Journal of Public Health. Both will be presented during this conference. Several of our academic programs, especially those in the allied sciences, are pioneering. We have therefore invited speakers and stakeholders to this conference to discuss postgraduate education in these disciplines as they transit from professional programs in the colleges of health, science, and technology to academic programs in universities. We have dedicated a day to each of our academic programs to discuss these peculiar issues. For example, from tomorrow, that is day 2 of the conference. The day 2 of the conference is dedicated to academic public health, and the chairperson of the day is Professor Antoinette Ofili, Professor of Community Medicine and Public Health, University of Benin, and the internal assessor, Faculty of Community Health, West African College of Physicians. The keynote lecture on that day will be delivered by Professor Sam Olufemi Sanwobo, the president of the Parasitology and Public Health Society of Nigeria. Day 3 of the conference is dedicated to the practice of public health, and the chairperson of the day is Dr. Adeze Ore. The 27th 27th Commissioner of Health of Rivers State, and the keynote lecture will be delivered by Dr. Kenneth Taffa. On Thursday is day 4 is dedicated to epidemiology, and the chairman of the day is Very Reverend Professor Lawrence Obonnaya, former president of the Epidemiological Society of Nigeria, and the keynote lecture on the multiple competencies of epidemiologists will be delivered by Dr. Akindele Adebiyi, president of Council, International Epidemiological Association. Day 5 is dedicated to health system management, and the chairman is Professor Seifa Brisbane, the Honorable Commissioner of Health, Bayelsa State, and the keynote lecture on equity in healthcare delivery in a changing disease landscape will be delivered by Dr. Obinna Oleribe of the School of Public Health and Health Sciences, California State University. Day 6 is dedicated to environmental health, and the chairman of the day is Professor Prince Mom, JP DSS RS, Vice Chancellor, Federal University of Environment and Technology, Ogoni, and the keynote lecturer on sustainable development in the midst of environmental degradation and climate change will be delivered by Professor Ijoma Vincent Akpo, the former president of the Association of Environmental Impact Assessment of Nigeria. Day 7 is dedicated to population and reproductive health, and the chairperson of the day is Professor Alice Inte, and the keynote lecturer is Dr. Sokarime, and he will be delivering lecture on sustainable efforts of past heroes of self-motherhood. The 8th is dedicated to health information management. The chairman of the occasion is Dr. Umar Farouk Abubakar, an associate professor of health information management, and the keynote address will be delivered by Dr. Kainde Opele. The 9th is dedicated to community health, and the chairman of the day is Dr. Kimbasin Daniel, a professor of community health, and the keynote address will be the keynote address on postgraduate education in community health will be delivered by Dr. Sikikat Onawola, the director of the Community Health Institute, Abuja. Day 10 of the conference is dedicated to public health nutrition, and the chairman of the day is Professor Salisu Abubakar, the president of the Nutrition Society of Nigeria, and the keynote lecture on making medicine out of food will be delivered by Professor Olivet Afam Anele, the president of the Dietitians Association of Nigeria. Day 11 is dedicated to health promotion and communication. The chairman of the day is Professor Ernest Achelu, and the keynote lecture on making medicine out of health talk will be delivered by Professor Walter Ihejrika. Day 12 is dedicated to occupational health, and the chairman of the day is Chief Dr. Roland Obed White, and occupational and health and safety experts. And the keynote address will be delivered by Professor Steve Abba. And finally, the 13th of the conference is dedicated to public health nursing, and the chairperson of the day, Professor Olade Edet, professor of public health nursing, and the keynote lecture will be delivered by Dr. Stanley Ajaka. So it is actually a very packed conference, a conference spanning 13 days, and each of those days dedicated to one aspect of public health. So, so let me just welcome you to this conference, and I know that it will be a memorable one because of the array, the events, and the array of distinguished speakers. Thank you very much, and welcome to the first scientific conference of the University of Port Harcourt School of Public Health. Thank you.
Thank you very much, Professor. Please, can you put your hands together? You can put your virtual hand on the chat box to let's make the chat room a bit interactive. So on the chat box, you can just put where you are joining in from. You know, like I'm Engineer Chisom joining in from Kara Namoda. Just put it there so it is interactive. All right. Thank you very much, Director, for your opening and welcome address. All right. So a public speaker once said, people watch things happen, others talk about things happening, but then some people make things happen. All right. Uniport is working because people and someone is steering the team of people making it work. May I respectfully invite the Digital Vice Chancellor, our Chief Host, Professor Onari Abraham Goodwill, the Vice Chancellor of University of Port Harcourt, for his welcome speech. VC, sir.
Thank you very much. The chairman of this annual scientific conference of the School of Public Health, Professor Chima Oabuo, my classmates, the chairman and members of Governing Council of the University of Port Harcourt, those who are online, the DVC admin, DVC academic, DVC R&D of the University of Port Harcourt, the keynote speaker, Professor Iyopo Simini-Alaye, immediate past DVC R&D, the Director of School of Public Health, Professor Bess Odnoa, other directors and center leaders who are present, distinguished professors, the management staff of the School of Public Health, beloved students of the School of Public Health, all stakeholders of the School of Public Health, ladies and gentlemen. It is with profound honor that I welcome you all to the opening ceremony of the first annual scientific conference of the School of Public Health, University of Port Harcourt. This gathering is not only historic in being the first of its kind in the School of Public Health, but also significant in its intellectual ambition, as it boldly situates itself within the global discourse on public health, service delivery, and national development. The choosing theme, Translational Research for Improved Service Delivery and National Development, is both timely and critical. It challenges us to move beyond knowledge for knowledge's sake, to knowledge that speaks, acts, and transforms. Translational research is, at its core, a bridge that collapses the distance between research findings and real-world application, between theory and practice, between laboratories and communities. In a nation, and indeed a continent, where health systems often falter under the weight of structural inequalities and resource constraints, the urgency of such translational efforts cannot be overstated. Today's gathering, therefore, though convened virtually, carries immense symbolic and practical weight. It demonstrates the University of Port Harcourt's commitment to engaging not only with scholarship, but with praxis, a scholarship that interrogates and reforms the very foundations of public health delivery. We believe that If the School of Public Health must serve its name, then it cannot remain a clustered discipline, but must confront the lived realities of citizens and align itself with the project of national development. Let me take this time to commend Professor Bess Odnoa, the Director, School of Public Health, for recognizing the invaluable contributions of distinguished scholars and practitioners through his Platinum Awards, Gold Award, Award for Excellence, and even, indeed, the Ignomy Award. These recognitions are more than ceremonial. They are discursive interventions that both honor excellence and confront failure. To immortalize ignoble actions through the Ignomy Award is a bold intellectual statement. It reminds us that memory must serve justice and that institutions must refuse, so sanctify mediocrity or betrayal of vision. I'd like to also express my gratitude to the chairman of the day, Professor Shima Wambuo, my classmates, and also the keynote speaker, Professor Yopos Minalai, the immediate past DVC Rwanda, for lending their voices and intellect to this noble cause. Their presence reaffirms the collaborative spirit of this conference. As Vice Chancellor, I reaffirm our institutional commitment to nurturing a culture of research, innovation, and service that responds to the needs of our time. The University of Port Harcourt stands ready to continually strengthen the School of Public Health and to provide the enabling environment for this vision to thrive. On this note, as the Vice Chancellor and Chief Host for this conference, I hereby declare this first annual conference of the School of Public Health open with a confident expectation that the conversations that begin here today will resonate far beyond this virtual space, inspiring action, reforms, and transformation. Let the discussions begin. Thank you and welcome on board.
Thank you very much, distinguished Vice Chancellor. Please put your hands together for him virtually and put on the chat box, thank you, dear digital VC. Put it on the chat box so he can see it enough and know that we love him. We love you, VC. You said Uniport is continuously ready to stand by the School of Public Health in making her strides. We thank you for that affirmation. May God bless you, sir. All right, so let us make progress. Once again, welcome for those joining in late. I'm going to welcome everyone from Ikwere Meka, those from Okrika Ebola, those from Kalabari Bateo, those from Bogoni, you tell me later. From Chinese, Chunhua, you're all welcome to this program. God bless you all. All right, so we're going to make progress as we listen to the chairman's speech. The chairman is no other but Professor Chima Onhuabunwo.
He just boarded a flight, and then he may not be able to give his speech now, so we'll skip it and probably go to the Goodwill messages.
No, I haven't boarded yet. I'm still here.
Oh. I followed you, sir. Okay.
Yeah, I want to.
Our distinguished chairman, sir.
I cannot afford to miss this great privilege and a thing of pride. Can you see me?
Yes.
Can you see me? Is it good?
Chairman, sir, please turn on your video so we can see
It's
you,
on.
sir.
Can you see me?
Perfect. We can see you now.
All right. Thank you very much, Director. I can't miss this for the world. I have a number of conflicts going on planned, but it will be an eternal regret if I miss an opportunity like this. Therefore, I would first of all recognize our chief host, the digital, who I call the People's VC, and the Golden Jubilee VC of Unique Uniport, Professor Owunari Abraham Goodwill, called in our parlance Prof. Owus. We are very proud of you, and we thank you for this opportunity. Particularly, I want to stand as on the existing protocol, and let me commend sincerely and with a great sense of pride the founding director of the University of Port Harcourt School of Public Health, Dr. Professor Best Odinioha, and all your deputies and the great professors and the Department of Community Health and Preventive Medicine who have worked together to establish this institution, the School of Public Health, as one of the its tops, both nationally and globally. And today again, you have proven that what you are made of by this innovative first step or first court of starting a School of Public Health, hosting a conference of not just a conference, but starting in a big bang with a 13-day conference. I don't know how many of us, even in global stands, have seen a conference that is this long. And we want to commend you, your team, and wonderful and dedicated students and staff who have made this happen. So I say that it is with great sense of pride because as an alumnus of the university, I have watched with great pride the developments across all departments, across the entire school, but particularly my core alma mater, the College of Health Sciences, and primarily the Department of Community and Preventive Medicine. And now, with the great addition in 2019 of the School of Public Health, again, I want to salute the great effort and the foresight and the innovation that has gone into all this. This conference this year, and the first of its kind, and appropriately themed translational research for improved service delivery and national development could not be more germane in the midst of the global discourse and conversations and effort. And it's a great compliment to the overall direction of the university that's, especially in this last 4 years or so, plus with the leadership of our dear digital VC and people's VC. The direction that the University of Port Harcourt has gone in in research and development, again fueled by the last impact of our very own outgoing Deputy Vice Chancellor for Research and Development, Professor Yopu Mirakiri Siminialai, my good friend and colleague. So the opportunity provided by this theme for our students, our partners, and the institution at large cannot be overemphasized. As the Vice Chancellor rightly defined, translational research is the melting point of the lab and the field, or the melting point of research findings and a professional practice and service delivery in particular. And of course, not just service delivery, but also policy development. And that's why the title National Development is critical, because the translational research plays a pivotal role in driving national development, in creating additional impetus for further research, and also bringing to bear the great minds, the findings of great minds in our citadels of learning to practice, to improve the lot of the citizenry nationally and globally. So it is my great honor and privilege to serve as the chairman of this history-making, epoch-making, they will say, history-making event And again, I want to commend and encourage all our students, partners, and staff to participate very actively and ensure that we do not leave here, as they would say, leaving any money on the table. Let's make sure we present confidently. Let's make sure we understand and take lessons learned from the individual research presentations as well as from the overall event that is going on today. It's a long 2 weeks, but I want to encourage us and plead with us to make the best of it. If we've put in our best foot out, we will not go away regretting. We would have obtained and gained great knowledge that will drive development in this upcoming decade by the grace of God. So again, I want to join the Vice Chancellor and the Director who has spoken earlier to thank everyone who has attended. The last time I looked on we're over up to 200 or thereabout have already joined, and what a great attendance and participation. So we look forward to a wonderful, challenging, and brainstorming 2 weeks and a time of great learning. And of course, we trust God that the impact of this meeting and this conference will last for many, many years, and that this will not be the last, that this will be the beginning of better and greater conferences like this and emulation by other departments and other schools. Again, it is a great honor and privilege to be here today. And I want to again thank all our colleagues that I didn't mention names here, whose names have been mentioned by the director. He took time to list all of you, and I recognize all your efforts and your contributions, not only to making this conference happen. But I have watched, like I said earlier on, your great strides in bringing University of Port Harcourt as a whole to be a force to be reckoned in the global academia. And may the Lord bless us and keep all of us and grant us safe returns when we travel back for those on ground, and grant us continuous success in our various endeavors. Thank you very much.
Thank you very much, Professor Chima. Please put your hands together for him in the chat box. Put in the chat box. Thank you very much, Professor Chima. Thank you very much. You said you had a lot of engagement, but it will be, I'm taking your words directly, it will be an eternal regret if I miss this golden opportunity. Thank you very much for that honor given to us. Thank you very much. Please put in the chat box those just joining, where you're joining us from. And Prof. Chima, you said as at when you joined, we are 200. I'm pleased to inform you that we are about 351, and possibly before we watch to the end of this program, we should see us hit 1,000 or more. So thank you very much once again, Professor Chima. God bless you. So we'll move on to the goodwill messages. Okay.
So we can start with the DVCs. I'm sure we have the DVC academic. I think she corrected me once. Professor Rosemary Ogu, hello ma, and DVC R&D, Professor Angela Frank Briggs, and DVC administration, Professor Nyaso. I think we can get them. Sorry, I've listed them in no particular order. We can you get them? Can we get them on? Hello, Professor Ogu. Hello, ma.
Okay, please, for the goodwill messages in no particular order, please, you can unmute Professor Rosemary Ogu for your goodwill message. Okay, if I'm not there, okay.
Thank you very much. Greetings, everyone, Mr. Chairman, our digital Vice Chancellor, Director, School of Public Health. Thank you. And the numerous participants that we have online, 359. It's absolutely delightful. Well done, everyone. Thank you. Please, let's keep it up. Greetings. Bye-bye.
Thank you very much. So Professor Frank Briggs at DVCR&D, please.
I wish you could unmute me. Okay.
We can hear you online.
Yeah, but
Good morning.
You need to mute one around you. Mute one system
Everybody.
around you.
Please, Prof, you can unmute so you can talk to us. Thank you.
The Vice Chancellor of the University of Port Harcourt, Professor Unare Abraham Georgeville. Please allow me to stand on the well-established protocol. But I must salute our keynote speaker, also our host, the Director of the School of Public Health, best house, our keynote speaker, my immediate predecessor, Professor Yoko Siminialai. It is with great joy that I extend my warm felicitation to the School of Public Health on the occasion of its first annual scientific and alumni meeting. I must say that it's a landmark event with the theme Translational Research for Improved Service Delivery and National Development. It is both timely and impactful. By bringing together researchers, practitioners, and alumni, we are not only strengthening academic and professional bonds, but also charting ways for enhanced and evidence-based solutions to our nation's health and developmental challenges. I am confident that the outcome of this conference will contribute greatly to shaping policies, enhancing service delivery, and promoting sustainable national growth. So I commend the leadership, staff, students, and alumni for this bold initiative. I wish you a fruitful celebration and continued success in advancing public health. Thank you and well done. Congratulations.
Thank you very much, Prof. Please put your hands together for her on the digital platform. Put on the chat box. Thank you, Prof. Briggs.
Can take the Goodwill message from Professor Kini Kanwon Anele, the Dean of the School of Graduate Studies. I don't know if he's around. Professor Anele. Okay. Then the Dean. I don't know if the Dean of the Faculty of Clinical, Provost College of Health Sciences, Acting Provost College of Health Sciences, Professor Ngozi Ekeke. Hello, sir.
Yes, I'm here.
Okay, please, sir. You can go ahead with your...
Can you hear me? Okay.
Yes, sir, we can hear you.
Good morning, Chairman of the occasion and our Chief Host, the Digital Vice Chancellor. Let me stand on existing protocol. It is with immense joy and pride that I, on behalf of the College of Health Sciences, University of Port Harcourt, extend warm congratulations to the School of Public Health on its first annual scientific conference and alumni meeting holding from the 15th to the 30th of September. This landmark event is not only a celebration of scholarship and innovation, but also a significant milestone in the school's journey towards excellence in public health education and research. The carefully chosen sub-theme, translational research for improved service delivery and national development, is timely and strategic as it underscores the urgent need to transform research findings into practical, sustainable solutions that improve healthcare systems and promote the well-being of our people. The conference, which brings together scholars, alumni, policymakers, students, and stakeholders, provides a vital platform to showcase the groundbreaking research of students and faculty, as well as to discuss postgraduate education in public health and allied health sciences. These deliberations will undoubtedly shape the future of public health practice, policy, and research, not only in Nigeria, but across Africa and beyond. The School of Public Health and College of Health Sciences share a symbiotic and mutually beneficial relationship. While the college serves as the cradle for training healthcare professionals and supplies the bulk of the academic and research staff of the School of Public Health complements this by providing a hub for advancing training, cutting-edge research, and innovation in public health and policy. Together, we form a continuum of service and impact, from clinical experience to preventive and community-based health interventions. This partnership is a model for collaboration and a testament to our shared vision of improving lives through knowledge, service, and leadership. I hereby publicly commend the school for your recent assistance granted to the journal of our college, the Port Harcourt Medical Journal. We are most grateful. We look forward to further assistance. We are deeply honored by the presence of our digital golden Vice Chancellor, a visionary leader of our unique university, as the special guest of honor. His dynamic leadership continues to inspire our pursuit for academic excellence, innovation, and national relevance. As you embark on this inaugural conference, I am confident that the ideas exchanged, networks built, and strategies developed will serve as a catalyst for advancing healthcare service delivery and fostering sustainable national development. On behalf of the entire College of Health Sciences, I congratulate the director, faculty, students, alumni, and partners of the School of Public Health on this historic milestone. May this event mark the beginning of an enduring legacy of excellence, collaboration, and impact on public health education and practice. Congratulations and best wishes for a most successful conference. Onyangonam Gozi Ekeke, Acting Provost, College of Health Sciences. Thank you very much.
Thank you very much, sir, for that goodwill message. I think the next one is from the provost, from the Dean, Faculty of Clinical Sciences, Professor McLean Akpa. I think he sent us his message. He sent us his message. I don't know if it's available for a readout, but we can go ahead and take the goodwill message from our sister center, from the center leader of ESPUTO, Professor Daprim Ogaji. Professor Ogaji, sir.
All right, thank you. Thank you very much.
Okay, you can go ahead, sir.
Yeah, I just want to get the audio right. It's like, are you hearing me, please?
Yes, we can hear you.
All right, thank you. Thank you. And greetings, the chairman of the occasion, the vice chancellor. Hello?
Go on, sir.
Okay. The vice chancellor and principal officers of the University of Port Harcourt, the acting provost, the deans, directors, and heads of department, let me stand on existing, already established protocol. It is with great honor and a heartful joy that I extend my warmest goodwill to the management, faculty, students, alumni of the School of Public Health and distinguished participants that are gathered virtually and globally for this landmark epoch-making event, which is the first annual scientific conference and alumni meeting of the University of Port Harcourt School of Public Health. This conference themed translational research for improved service delivery and national development could not have come at a more critical time when our health systems, policies, and practices must increasingly be driven by evidence, innovation, and cross-sectional or sectorial collaboration. Annual scientific conference by the School of Public Health, such as the University of Port Harcourt School of Public Health, carries significant academic, institutional, national, and global relevance. And I'm very sure that this will not just be one of its kind, but a continuous phenomenon in the School of Public Health. I'm also proud to remark that the African Center of Excellence in Public Health and Toxicological Research had held regular annual scientific conference every March of every year since 2019, and has supported the university's annual research, innovation, and entrepreneurship workshops since 2022. The School of Public Health and the African Center of Excellence in Public Health share common history. This occasion brings me personal fulfillment as it marks the institutional maturity of an idea born out of what might be considered rightly as the audacity of courage, which was leading the establishment of both the School of Public Health and the African Center of Excellence in Public Health and Toxicological Research in 2018, while serving as the head of the Department of Preventive and Social Medicine at the University of Port Harcourt. Now, this was guided by a vision to transform postgraduate public health education in Nigeria and across Africa. These two platforms have become beacons of excellence, anchored by the University of Port Harcourt School of Public Health academic breadth and the African Center of Excellence in Public Health and Toxicological Research Continental Research Mandate. Since the commencement of academic activity in the school in June 2019, the School of Public Health has grown remarkably under the capable leadership of Professor Best Odino. The school at inception, which comprised of 4 dynamic divisions, epidemiology, health system management, environmental health, and population reproductive health, has grown to have 13 divisions. So what that means for us today is that virtually anything public health training can be obtained in the School of Public Health. Today, the school stands proudly as a regional hub for advanced public health education that continues to attract students from across Africa and beyond. I believe that the foresight in leading this establishment of postgraduate platform in the University of Port Harcourt laid the foundation for a resilient and evolving public health training ecosystem in the University of Port Harcourt. The key constituents of this University of Port Harcourt public health training ecosystem includes the School of Public Health, the African Center of Excellence in Public Health and Toxicological Research, and the Department of Preventive and Social Medicine under the Faculty of Clinical Science. These all share a common mission, which is to produce globally competitive professionals, conduct impactful research, and contribute to sustainable national development. Together, these platforms have achieved a lot within the last 6 years, such as the development of nationally and internationally accredited academic program, the expansion of access to academic postgraduate training for local and international students, the establishment of a robust online training infrastructure, and a meaningful contribution of these institutions to the University of Port Harcourt, to Nigeria and to global development goal. I'm deeply humbled and grateful to the director and the management of the University of Port Harcourt School of Public Health for nominating me as a recipient of the University of Port Harcourt School of Public Health Gold Award. This recognition is not just a personal honor, but a celebration of collective courage, vision, and perseverance shared with many of our colleagues, partners, and stakeholders. As we open this conference today, I once again congratulate the director, the faculty, the students, and the alumni of the University of Port Harcourt School of Public Health for the extraordinary progress made in such a short time. I encourage you to continue to build on this foundation, to dream boldly, to act courageously, and to research purposefully for the health and well-being of the nations in Africa. I wish you all a productive, insightful, and impactful conference. Thank you, and congratulations once again. God bless us all.
Thank you, Professor DST. I'm sure that those of you in that are being sponsored by Esputo, I'm sure that you have seen him. You have seen your major sponsor. Thank you very much, Professor DST Ogaji. I think next we'll get a Goodwill message from the Department of Preventive and Social Medicine, Professor Omosibe Madoka. Professor Madoka, ma.
Good morning, the Digital Vice Chancellor and Principal Officers of the University of Port Harcourt. Warm felicitations also to all the provosts, deans, heads of department, the chairman of today's occasion, and of course, especially to the Director School of Public Health and every other dignitary here present. On behalf of the Department of Preventive and Social Medicine, the College of Health Sciences, Faculty of Clinical Sciences, University of Port Harcourt, I stand to express our warm felicitations with the School of Public Health on this milestone achievement, its first annual scientific conference, which is a 13-day event. We are extremely excited to be not just associated with the School of Public Health, but we consider ourselves part and parcel of the School of Public Health. The Department of Preventive and Social Medicine was there at the very beginning of the conceptualization, the actualization, and the initial growth pangs of the School of Public Health. And we are indeed proud of the stellar achievements of the school over the past 6 years. On behalf of the department, we pledge our continued support for the school. It is our desire that the school will continue to make national, regional, and international impact in its quest to train world-class public health professionals in the country and in the world at large. Kudos to the director, kudos to our vice chancellor, and well done for this epoch-making event. Thank you.
Thank you very much, my HOD, Professor Madoka. Sorry, one omission. We are supposed to have a Goodwill message from the hospital, the teaching hospital. I don't know if Professor Alazia is around, is on call. If he is, he can give his Goodwill message. I don't know. Okay. If we don't have him, then we can go ahead with the next item, which is the citation of the keynote speaker. So we are going towards the highlights of today's opening ceremony. So let's take the citation of the keynote speaker, which was pre-recorded.
Professor Iyopu Minakiri Seminalayi is a professor of endocrine pharmacology. He was the best graduating student in pathology in his 1991 MBBS graduating class at the University of Port Harcourt and also won Professor Maba DJ's Prize for Best Graduating Student in MSc Pharmacology at the University of Lagos. He holds an MD from the University of Port Harcourt. Professor Siminalayi joined the University of Port Harcourt on July 1, 1994 as Lecturer 2 in the Department of Pharmacology and rose to the rank of Professor in October 2010. He is a respected pharmacologist and endocrinologist, widely cited for his work on metabolic syndrome, diabetes mellitus, and malaria. His studies have shown that diet, even in the absence of obesity, is a major determinant of metabolic syndrome, that low HDL cholesterol is a poor marker of the condition, that abdominal obesity, even with a normal BML, is strongly linked to cardiovascular risk in Nigerians, and that extracts of marine crabs can inhibit the replication of growth of Bordetella pertussis. He has benefited from travel grants from Pfizer, Ugo Basil URL, the University of Port Harcourt, and the European Union Erasmus Plus Training Mobility, as well as won a TED Fund IBR grant for his research on dietary intervention in type 2 diabetes remission. He also secured a grant from the Niger Delta Development Commission while serving as director of the Center for Malaria Research and Phytomedicine. Professor Siminalayi has over 100 published articles, some from multi-center studies, and has supervised 16 MSc projects, one of which won third prize at the NUC National Research Fair in Abuja in 2012, as well as 11 PhDs. He was listed among the top 800 scientists in Nigeria by Webometrics in 2015 and also ranked in the AD Scientific Index. He has served as head of department, dean, Director of the Center for Malaria Research and Phytomedicine, and Provost of the College of Health Sciences. As Provost, he revised the MBBS and BDS curricula and established quality assurance in assessments. As Deputy Vice Chancellor for Research and Development, he instituted the annual Innovation Week and contributed to the improved ranking of the University of Port Harcourt among Nigerian universities. Professor Siminalayi is a former member of the Medical and Dental Council of Nigeria, Medical and Dental Practitioners Disciplinary Tribunal, and the board of the University of Port Harcourt Teaching Hospital. He is the Sylvanus J.S. Cookie Professor of Malaria Studies and the immediate past Vice Chancellor, Research and Development, University of Port Harcourt. He is a fellow and life member of West African Society for Pharmacology, a recipient of the Nigerian Medical Association Roll of Honor, a fellow of the Nigerian Academy of Medicine, and a distinguished alumnus of the University of Port Harcourt. Outside his professional career, he enjoys table tennis, chess, and other board games, as well as music, books, and football, with a particular passion for Arsenal Football Club. He is active in community-based organizations, a philanthropist, and is happily married with children.
Keynote address. Professor Siminalayi, sir. Okay, sir, you can unmute.
Okay, can you see my slide, please?
Yes, sir, we can.
Okay, all right, let's get this rolling. Okay. Thanks. Sorry. Right, so Chairman and Vice Chancellor, please permit me to adopt a very well-established protocol. But also permit me especially commend the Director of the School of Public Health for the excellent work he's done over the last 6 years or so in guiding our School of Public Health. May I also especially recognize the academic leadership and faculty and students of the University of Port Harcourt School of Public Health for organizing this first annual scientific conference of the School of Public Health. In this keynote, we explore how the knowledge generated in our universities can directly improve health services and drive national development, ensuring that the great ideas cultivated in academia translate into concrete benefits for our communities and country. I speak to you today not only as an academic, but as the immediate past Deputy Vice Chancellor in charge of research and development. My hope is that this lecture inspires each of you, whether you are a postgraduate student beginning your research journey, or a lecturer guiding the next generation to engage in research that advances lives and advances national development. Nigeria stands at a critical juncture. With Africa's largest population and economy, our nation cannot afford to let research findings gather dust in libraries, while urgent societal needs go unmet. From persistent public health challenges to gaps in basic services, the urgency to harness research for policy and implementation has never been greater. For example, Nigeria tragically accounted for 82,000 maternal deaths in 2020, over a quarter of all maternal deaths worldwide. This sobering statistic underscores the urgent need to do things differently. If Nigeria is to achieve its development ambitions, whether it be the Sustainable Development Goals by 2030, or our own Nigeria Agenda 2050, or becoming the top middle-income economy, we must urgently bridge the gap between knowledge and practice. Our nation has never lacked policies or plans on paper, yet implementation remains a chronic weakness. Translational research offers a pathway to overcome that weakness by ensuring that evidence and innovation actively inform how we deliver services and implement policies. Translational research is broadly defined as a scientific approach focused on quickly and effectively moving basic science or laboratory-based research discoveries into practical applications to improve human health. In practical terms, it involves moving ideas from labs or studies into clinical practice, policies, products, or services. In healthcare, this is often called the bench-to-bedside process. But true translation continues from the bedside to real-world practice, ensuring that health innovations reach communities, resulting in new treatments, diagnostic tools, or preventive measures. To differentiate, basic research asks, how do things work? And builds our knowledge foundations, often in controlled settings or laboratories. Translational research takes those insights and asks, how can we use this knowledge to improve health or services? It often involves interdisciplinary teams and can include designing interventions, developing technologies, or crafting new policies based on evidence. In the medical field, for example, basic science might discover a new drug target. Translational research develops a drug and tests it so that it can be delivered to patients. In public health, basic research might identify risk factors for a disease. Translational research designs a community program or policy to reduce those risks in practice. Within public health and health systems, translational research overlaps with what we call implementation science, knowledge translation. These emerging fields focused on bridging the research to practice gap by integrating research findings into routine care and services. The aim is to speed up the often lengthy process of moving what we know into what we do. For instance, it's frustratingly common that proving health interventions like a new vaccine or an improved treatment protocol takes years or even decades before they are widely implemented. Translational efforts try to shorten that delay so that people benefit sooner from innovation. As illustration, consider the continuum of research in medicine. Basic science might identify how a virus infects human cells. Translational research uses that knowledge to develop a vaccine. Clinical research then tests the vaccine in trials, and implementation research figures out how to roll out the vaccine effectively in the community. All these stages are vital. However, translational research is the linchpin that connects the early discoveries the later real-world benefits. Without it, a breakthrough in the lab may never become a breakthrough in the lives of patients. It is precisely this approach that can help Nigeria and other African nations solve local problems with homegrown solutions. Because we have graduate students in attendance here, let me define service delivery and then take a few examples. Service delivery is a health system, refers to the process of providing healthcare services to individuals and populations. It encompasses the entire spectrum of activities, from health promotion and disease prevention to treatment, rehabilitation and palliative care. Effective service delivery is crucial for improving health outcomes and requires an effectively functioning system with strong inputs and efficient processes. Now, the examples. One powerful example comes from Enugu State. A few years ago, the Enugu State Ministry of Health wanted to ensure that frontline clinics had the necessary commodities to fight malaria, specifically rapid diagnostic tests and artemisinin-based combination therapies. Lacking data on availability, partnered with the local health policy research group, assess the situation across health facilities. Research revealed critical gaps, guiding the ministry on how to allocate resources. According to a state policymaker, we used the results of the study when we were supplying RODTs and ACTs to our health centers. The study guided us very well. We have RODTs and ACTs all over the facilities now. This is translational research in action. A study identified the service delivery gap. Its findings were immediately applied to ensure life-saving diagnostics and medicines reach clinics, thereby improving care for patients. Example 2. Translational research also addresses the oft-seen lag between what is known in research and what is done in practice. There's frequently no-do gap, where health workers and service providers may not be using the latest evidence-based practices, sometimes due to lack of awareness or training. For instance, research might show new protocol for managing obstetric emergencies that significantly reduces maternal deaths. Translational efforts will involve piloting that protocol in hospitals, training nurses and doctors, and monitoring the outcomes to refine implementation. By doing so, the gap between knowledge generation and field application is closed. Too often in Nigeria, as in many countries, excellent research findings remain stuck in journals and theses without influencing day-to-day practice in clinics or communities. In fact, health research evidence published in academic journals barely make it public in policy-making conversations because traditional academic dissemination is so limited and insular. Translational research consciously breaks this barrier. It's about taking that evidence and pushing it into the hands of practitioners and decision makers in a usable form. Another example. Consider the example of Nigeria's National Health Insurance Scheme and its policy for formal sector social health insurance program, FSHIP. For years, there was poor uptake of this health insurance at the state level. Many state governments simply didn't enroll their employees, partly due to a policy design that required sending contributions to a central pool. Researchers, together with the Federal Ministry of Health, investigated this issue in a translational research project. It involved policymakers in framing the research questions and even in data collection. The results gave actionable insights. It became clear that states would prefer to keep funds locally to run their own schemes. Armed with this evidence, the NHIS used the study's findings to redesign the insurance program, allowing state-level retention of funds, leading to greater acceptance by state governments. One policymaker noted, immediately that result was disseminated, we had a change in mind about the FSHIP. Even other states are following suit. This is a concrete case of research bridging into policy and improving service delivery, as more Nigerians can now be covered by health insurance tailored to local governance realities. Sometimes The value of translational research is in spotlighting where services are failing and how to fix them. For example, implementation research in Nigeria has identified delays and bottlenecks in maternal and child health services, such as why pregnant women might not reach facilities in time, or why a proven intervention isn't being provided at primary healthcare centers. By engaging with both community members and health workers, researchers can develop solutions like community bed plans or task shifting training for health workers, and then work with government to implement these solutions. The key is collaboration between researchers and frontline service providers. When researchers go into the field, into villages, clinics, schools, and work alongside implementers, not only gather rich data, they also build trust and ensure the eventual recommendations are practical. One lesson from successful translational projects is the importance of continuous stakeholder engagement. In Enugu, for example, and others like it, researchers didn't just drop a report on the ministry's desk. They maintained bi-monthly meetings, updates, joint problem solving with the officials. This ongoing dialogue meant that when the findings came, policymakers were already primed to act on them, felt ownership of the research process. Continuous engagement turns research from a one-way knowledge transfer into a two-way collaboration, effectively smoothing the path for evidence to translate into implementation. Franca, despite these successes, we must candidly acknowledge that Nigeria's landscape is still full of instances where knowledge and service delivery remain disconnected. We have universities producing hundreds of theses on public health each year, yet many public health programs continue business as usual without integrating new evidence. This gap represents lost opportunities. Translational research is about capturing those opportunities and ensuring that every useful insight from our laboratories, surveys, and data analysis finds its way into the hands of those delivering services or making policies. The next section will broaden the lens of national development to national development, examining how this approach not only improves services, but also aligns with our country's broader development goals. National development refers to the comprehensive advancement of a country, encompassing its economic, social, political, and technological progress, with the aim of improving the overall well-being of its citizens. It involves strategic planning and coordinated efforts to achieve sustainable and inclusive growth across various sectors. It means overall social economic progress of the nation, higher living standards, inclusive growth, better education and health, and sustainable management of resources. Specifically, we refer to the broad socioeconomic progress of Nigeria, reducing poverty, improving population health and education, building a sustainable economy, and achieving goals like those in the Nigeria Agenda 2050 and the Global SDGs. When research findings inform and improve service delivery, the result is stronger development outcomes. At its core, research, innovation, and national development are intimately connected. No nation has achieved long-term development without investing in knowledge and applying that knowledge to innovation. In the world's most advanced economies, innovation driven by research contributed massively to growth. For instance, an analysis in the UK found that 2/3 of private sector productivity growth was linked to innovation in the 2000s. Countries like South Korea transformed from low income to high income in a few decades, largely by focusing on research and development, becoming knowledge economies. Nigeria's leadership recognizes this, at least on paper. Our National Development Plan 2021 to 2025 and the longer-term Nigeria Agenda 2050 highlights science, technology, and innovation as critical enablers for sustained inclusive growth. The Agenda 2050 aims for Nigeria to be among the world's top economies by 2050, creating 165 million new jobs and virtually eliminating extreme poverty. These are ambitious targets. Achieving them will not happen by merely doing more of the same. We need policy reforms and innovations grounded in research evidence. How can translational research concretely advance national development? Let's explore a few areas. A healthy population is both an outcome and driver of development. Translational health research can inform national progress to combat diseases that sap our productivity and human capital. For instance, Nigeria continues to battle high rates of infectious diseases like malaria, HIV, TB, and emerging threats such as COVID-19, Lassa fever, and so on. Research done in our laboratories and universities, when translated effectively, can lead to locally adapted solutions. A shining example was during the COVID-19 pandemic. Nigerian scientists at the African Center of Excellence for Genomics of Infectious Diseases, SGAID, were the first in Africa to sequence the SARS-CoV-2 genome in March 2020. This rapid sequencing capability, led by Professor Christian Happy's team, gave Nigeria and Africa a head start in tracking variants and understanding the virus spread. It also demonstrated how investment in research capacity, genomics in this instance, translates to improved epidemic response, which is critical for national security and economic stability. Professor Happy's lab similarly helped contain the Ebola outbreak in Nigeria in 2014 through quick diagnostics. These instances show that when research capacity is translated into action, lives are saved and public confidence in the system increases, allowing the country to avoid deeper crises and stay on track with development. Translational research provides the evidence base that can drive policy reforms at national scale. The example of maternal and child health, an area tied to multiple SDGs, health, gender equality, etc. Research has highlighted the 3 delays contributing to maternal mortality in Nigeria: delays in seeking care, reaching care, and receiving quality care. These insights have informed national strategies like the emergency maternal and obstetric care training programs and the push for emergency transport systems for pregnant women. By translating these research findings into policy, for example, the National Task Shifting and Sharing Policy, which allows trained community health workers to provide certain life-saving interventions, Nigeria has aimed to address healthcare workforce gaps. Policy reforms such as these, grounded in research, are essential to reach our national targets of reducing maternal mortality, improving health outcomes. Moreover, translational research in health systems, like the work by the Nigeria Implementation Science Alliance, helps to pinpoint why certain health policies aren't effectively implemented and how to fix that. This strengthens governance and accountability in our health sector, an important aspect of development. Translational research often leads to technological innovation and new enterprises, which contribute to economic development. When universities focus on applied research questions, for instance, how to convert agricultural waste to useful products, or how to develop a new software for health records, they can produce inventions and startups. A local example is University of Port Harcourt's Opecosyn project, which is explicitly designed to transform research into marketable solutions. Funded by an Africa-wide initiative that is PASET's RSIF, Opecosyn addresses the gap where many Nigerian university research findings never reach the market. This project is training faculty and postgraduate students on how to patent their inventions, create prototypes, and partner with industry. The goal is to make Uniport a hub of entrepreneurial research, especially in sectors key to Nigeria's economy, oil and gas, through the Center of Excellence for Oilfield Chemicals. Already, This translational ethos has led to tangible outputs. For example, the project facilitated filing of patents and the development of mobile biogas digester prototype for sustainable energy. This kind of ecosystem, where academic research results in new technologies or services, can drive industrial diversification, create high-skilled jobs, and reduce our reliance on imports by providing homegrown solutions. National development in Nigeria also hinges on advances in agriculture, where over a third of our workforce is employed. Translational research has given rise to innovations like biofortified crops. To tackle malnutrition, Nigerian and international researchers developed vitamin A-enriched cassava, or yellow cassava, to address pervasive vitamin A deficiency in our population. This scientific breakthrough was translated into farm practice. Today, many farmers in Nigeria grow vitamin A cassava, and consumers eat garri or fufu that helps improve nutrition. Studies that show that such biofortified cassava can indeed contribute to better vitamin A status in children. This is a clear case where lab science breeding higher beta-carotene cassava translated into a development intervention, helping to reduce hidden hunger, aligned with SDG 2, zero hunger, and SDG 3, good health. It's also an example of research informing national policy. Government's agricultural extension and nutrition programs now include promotion of biofortified foods. When we scale up these efforts, the payoff is a healthier, more productive populace and lower healthcare costs from malnutrition, all contributing to socioeconomic progress. Translational research in education is equally vital for development. For instance, if educational psychologists in our universities research teaching methods that improve literacy among children, those findings should inform teacher training curricula and classroom practice nationwide. By pilot testing research-based methods in local schools is the translational step, and then partnering with government to adopt successful approaches, we can raise the quality of education. A well-educated workforce, the cornerstone of development, feeding into every sector. This highlights that translational research is not just about gadgets and clinical trials. It spans policy development, educational reform, and social innovations as well. In all these examples, a common thread emerges: evidence-based innovation. National development requires that policies and programs are designed on evidence of what works, and that innovations are tailored to our contexts. Translational research provides that evidence in a locally applicable form. It also promotes a culture of learning and adaptation. As policies are implemented, researchers evaluate them, and the feedback loop refines the policies. This dynamic interplay between research and action is how countries solve complex problems over time. However, if translational research is to fully play this developmental role, certain challenges must be overcome. Nigeria still faces systemic hurdles that hinder the smooth flow of knowledge into practice. Let us now discuss these challenges, because recognizing and addressing them is crucial if we are to unleash the potential of translational research for our nation's advancement. The challenges hindering translational research. There is often a disconnect between researchers and policymakers in Nigeria. Studies have found a lack of adequate understanding of the complex nature of translating research into policy, and an incompatibility between researchers and policymakers, which poses a great challenge to evidence-informed policymaking. In other words, our institutions have not fully institutionalized mechanisms for research findings to routinely feed into policy design or revision. Unlike some countries where government agencies have dedicated research units or strong links to academia, Nigerian policymakers may not regularly consult local research or may be unaware of relevant findings. This weak pipeline means many policies are made based on convention or external advice rather than Nigerian research evidence. And conversely, Nigerian researchers often don't know the pressing policy questions that government needs answers to. Efforts like one-off workshops or forums that try to bridge this gap but the pipeline remains largely ad hoc instead of systematic. Inadequate funding for research is a chronic issue that undercuts translational efforts. Nigeria invests only around 0.2 to 0.3% of its GDP in research and development, far below the African Union's target of 1% and the levels in countries that have harnessed innovation for development. This means our universities and research institutes struggle with limited resources for conducting high-quality studies, let alone scaling successful pilots. Moreover, lack of funding was cited by about 43% of Nigerian scientists as the top constraint on research productivity, with many resorting to personal funds to carry out studies. The consequences for translational research are severe. Promising findings might never be tested in larger implementation trials. Engagement activities like stakeholder meetings or policy dialogues may be skipped due to costs. And innovative prototypes, say a new low-cost ventilator or diagnostic tool, may not get the funding to develop into a marketable product. Insufficient funding also ties into brain drain, as talented researchers leave for countries where funding and facilities are better, depriving us of the very people who could drive translational projects. Indeed, brain drain and lack of motivation due to poor support were identified as significant barriers by researchers in Nigeria. Without greater investment, translational research will remain sporadic and dependent on foreign grants, which are often tied to foreign agendas. There is a cultural and institutional gap between academia and government in Nigeria. Universities traditionally reward publications and academic outputs, while government officials prioritize actionable solutions and quick results. This can lead to mistrust or undervaluation of each other's work. A Nigerian newspaper recently lamented, quote, why the government depends less on local researchers, end quote, noting issues such as misalignment of research topics, policy needs, and difficulties in communication. From the academic side, researchers may feel that government does not seek out evidence or that bureaucratic red tape hinders collaboration. The result is a silo mentality. Researchers work in isolation on topics that interest them. Policymakers make decisions with minimal input from domestic research. Glaring communication gaps have been documented. Massive gaps in communication between health researchers and policymakers in Nigeria constrain the use of research evidence for policymaking. This disjoint means that even where relevant findings exist, they often fail to reach institutions or people who could act on them. Likewise, policymakers may not articulate their evidence needs to academics, missing opportunities to commission targeted research. For example, a state government might need data on why immunization uptake is low in this area, and such studies could be done by local universities if a partnership existed. Beyond institutional gaps, there are cultural differences in how academics and policymakers and indeed practitioners operate. Academics tend to communicate in technical language, lengthy reports, and journal articles that are not easily digestible to a lay or political audience. Policymakers and practitioners often need concise briefs, clear recommendations, and timing that fits budget or electoral cycles. This mismatch can be a barrier. As one study pointed out, evidence in journals barely make it into policy circles due to the restrictive and technical nature of academic outputs. Additionally, there can be skepticism. A policymaker might question the practicality of an academic's proposal, while a researcher might complain that policymakers don't appreciate nuance or scientific uncertainty. Another barrier is the lack of trust. Some policy actors may favor international expert opinions over local research, or view academics as too theoretical. Conversely, researchers might view engagement with media or policymakers as popularization and beneath them, which is a mindset that needs changing. This communication and cultural barriers mean evidence isn't translated effectively. Either it's not presented in the right format, or it's not presented at the right time, or the right relationship doesn't exist to have influence. Nigeria has had various initiatives to promote evidence-based policy, from the EVIPNet workshops to the establishment of the National Evidence for Policy Committee years ago. But many have not been sustained. Frequent turnovers in government, administrations, or officials can disrupt boarding collaborations. What one health commissioner or minister supports might be neglected by their successor. Similarly, research products often end at the pilot or publication stage without follow-through to scale up. The inability or unwillingness of administrations to carry on with previous projects is a recognized bottleneck in Nigeria's development efforts. This affects translational research when, say, a successful trial program is not institutionalized across the system due to leadership change or shifting priorities. We need to build structures that outlast individuals, such as institutional partnerships, and policies mandating the use of evidence in certain processes. Translational research requires specific skills that bridge research and practice. For example, the ability to craft policy briefs, to conduct implementation studies, to manage multi-stakeholder partnerships. These skills are not yet embedded in our postgraduate training or our public service. While we produce excellent specialists in various disciplines, we have fewer translational specialists or knowledge brokers. The result is that even when evidence exists, it might not be packaged well for uptake. Likewise, on the government side, not all departments have the capacity to interpret research data or an appetite to integrate new practices. Some might see it as added work or risk. Encouragingly, however, some efforts are addressing this. Workshops to train both researchers and policymakers in evidence and policy processes have shown improved skills and understanding. But these need to be scaled up dramatically to normalize a culture where everyone expects decisions to be informed by data. In summary, Nigeria's challenge is not a lack of ideas or lack of intellect. Our universities and research institutions generate knowledge, and our problems are being studied. The real challenge is in the translation. The journey from research results to real-world change is obstructed by systemic and cultural hurdles. A lack of interest or demand from policymakers, as one study highlighted, leads to limited funding and motivation for research, creating a vicious cycle. Breaking that cycle will require concerted action from both academia and government, other stakeholders like industry and civil society. In the next sections of this presentation, we will discuss the crucial role of you, the postgraduate researchers, and what our institutions and government must do to overcome these barriers. If we address these challenges head-on, we can unleash the full power of translational research to improve lives and advance our nation. So, our dear postgraduate students, let me emphasize, you are the future of research and innovation in Nigeria. The mantle of bridging research and real-world impact will soon rest on your shoulders. Your role is critical because postgraduate researchers are the engine of knowledge production. You carry out experiments, field studies, data analysis, and you are also at the ideal stage to embrace new ways of doing research that are action-oriented and relevant to societal needs. So how can you rise to this responsibility? First, cultivate a mindset of solution-driven research. As you select your thesis or dissertation topics, think beyond the academic requirements. Ask yourself, what problem is in my community or country could this research help solve? Whether you are in public health, medicine, or any field, there are pressing questions all around. For instance, how can we increase immunization rates in remote villages? What's an affordable way to improve water quality in rural areas? How do we better manage hypertension in our local clinics? Designing your research with such real-world questions in mind is the first step of translational thinking. It doesn't mean compromising on rigor or theory. It means ensuring your work has a line of sight application. Remember, a PhD or MSc thesis that sits on the shelf helps no one. But one that engages with a real problem can lay the groundwork for a program or policy change that helps thousands. Second, engage with stakeholders early and often in your research. This includes community, practitioners, or policymakers related to your study. If you're researching, say, maternal health services, spend time in the clinics, talk to midwives and patients, involve the state primary healthcare board if possible. By involving these stakeholders from the beginning, you ensure your research asks the right questions and that the people who might use the findings are aware and interested. The experiences shared by successful translational projects in Nigeria show that involving end users and decision makers throughout the research process leads to greater uptake of results. As a student, you might feel it's challenging to reach officials or frontline workers, but you'll be surprised. Many are happy to collaborate if approached professionally, because they too want solutions. Your supervisors and university can facilitate these connections. We'll talk more on that in a short while. Third, embrace interdisciplinary and collaborative approaches. Real-world problems do not come neatly packaged by academic discipline. Solving them often requires multiple perspectives. As postgraduate researchers, be open to working across fields. A public health issue like malnutrition might benefit from teaming up with an agriculture student for food security solutions, or a communication student for behavior change campaigns. Collaboration not only enriches your research, it also mirrors the interdisciplinary nature of implementation in practice. When your work eventually translates to action, it will involve different sectors. By collaborating early, you produce more holistic findings that are easier to translate. Importantly, collaboration builds networks. A young researcher network with peers in other disciplines and with practitioners is positioning themselves to be a change maker who can mobilize teams to implement ideas. Fourth, develop your skills in knowledge translation. This means learning how to communicate your research to non-academic audiences. Practice writing policy briefs or summary reports of your findings with clear recommendations. During your program, take opportunities, seminars, workshops on research communication or evidence to policy training, if available. Some Nigerian researchers have benefited from workshops on evidence-informed policymaking, reporting, and significantly improved their understanding of how to package and present evidence to decision makers. Seek mentorship, not only from your academic supervisor, but also from mentors in the policy realm, perhaps an alumnus who works in government, or a professional in an NGO. These mentors can provide insight into the priorities and language of the policy world, helping you tailor your approach. Being able to translate and communicate effectively will distinguish you in your career and ensure your hard-won findings actually make a difference. Fifth, be proactive in pursuing implementation of your research. Don't consider your work done when you submit your thesis or publish a paper. That's actually when the translation work begins. For example, if your study found a new intervention is effective, perhaps a new health education module that improved outcomes in the pilot, champion it, present it to the local health authorities, volunteer to help draft guidelines or conduct training to replicate it. or partner with an NGO to scale it up. This kind of initiative might seem beyond a student's typical role, but it is exactly what translational research entails, following through. We have examples of young Nigerians doing this. During the COVID-19 pandemic, a 20-year-old engineering student from Ahmadu Bello University, Usman Dalhatu, he didn't stop at designing a prototype mechanical ventilator. He actively sought support to improve and mass produce it, and even got a patent for another device of his. His drive to see his innovation through to real-world use is an inspiration. Not every research product will invent a device, but whatever your result is, data set, the software, protocol, consider how it could be implemented and take steps to connect with those who can implement it. Finally, recognize your role as ambassadors of evidence-based change. In the near future, many of you will move into positions as academics, consultants, policy advisors, or entrepreneurs. The values and habits you form now will carry over. If you champion translational research during your postgraduate years, you'll carry that ethos into your career, influencing others and perhaps shaping the policies of the institutions you lead. Nigeria needs a new generation of researcher leaders who insist on seeing evidence put into action. You are the thinkers who must now become the doers. Be vocal that research is not just an academic exercise, but a public service. Encourage your peers. Form student interest groups on research for development or similar things, and engage in events that connect academia with the public. In essence, postgraduate researchers must transition from working in isolation to working in integration, integrating the communities with other disciplines and with end users of knowledge. This will not only enhance the impact of your own research, but also push the entire system toward a culture of translation. It's a responsibility, but also an exciting opportunity. You get to see your work make a real-world difference, which is deeply fulfilling and the ultimate goal of scholarly pursuit. Institutional roles. Building a vibrant ecosystem for translational research in Nigeria requires concerted efforts from multiple institutions. Key among them are our universities, especially leadership in research-intensive units, and the School of Public Health. The government at all levels and the broader academic community, lecturers, supervisors, research institutes, each has distinct but complementary roles to play. Our universities must be the incubation centers for translational research. University of Port Harcourt has already signaled its commitment by aiming to become an entrepreneurial research-intensive institution. It was the first university in Nigeria to declare this vision back in 2010. To fulfill that, universities should mainstream research translation into their core activities. What can this look like? Introduce modules on research to policy, implementation science, and innovation management in postgraduate programs. For example, the School of Public Health could have a course where students learn how to write policy briefs or design pilot interventions based on evidence. This formal training builds capacity for translation. Universities can also create incentives for faculty and students to undertake research in areas aligned with national and community needs. For instance, Uniport might identify priority themes each year, e.g., improving primary healthcare systems or environmental health challenges in the Niger Delta, and provide small seed grants for interdisciplinary teams to work on these. We can also establish institutional platforms or units focused on translation. Some ideas include a research to policy liaison office that actively engages with government ministries, translating faculty research into briefs, and organizing policy dialogues or incubation centers that help develop research innovations into prototypes or startups. Uniport's Up Ecosyncs project serves this function for commercialization. The university could host annual research policy roundtables, bringing together academics, policymakers, and practitioners to discuss findings and how to implement them. Importantly, recognition and rewards. Academia traditionally rewards publications and citations. Pivot towards translation. Universities should also recognize and reward impact. Could a faculty member's promotion dossier, for example, include evidence of policy impact or implemented solutions from their research? Perhaps, quote, an outstanding translational research award can be given to teams whose work led to a change in practice or a spin-off product. When lecturers see that supervising a student whose thesis leads to a real intervention is valued, will encourage more such projects. This shifts the academic culture to value usefulness alongside rigor. The government must put its money where its mouth is. We need sustained, adequate funding, specifically earmarked for research that addresses national development challenges. Tertiary Education Trust Fund has been a positive driver through its National Research Fund grants, which encourage cutting-edge research in areas relevant to national development. The research community should advocate for Nigeria to progressively raise R&D spending from the current 0.2% of GDP toward the African Union's 1% target. Bilateral research funding schemes could be a game changer. Imagine each federal ministry having a research for policy fund that academics can competitively bid for, provided their projects address specific policy questions the ministry wants answered. This will tightly couple research with policy needs. Policy uptake mechanism. Governments should create formal pathways for evidence to inform decisions. One approach is establishing knowledge broker units or science advisory positions in ministries. For instance, the Federal Ministry of Health could have a dedicated health research translation department that liaises with academia, scans for relevant research, and coordinates evidence synthesis for policy formulation. Furthermore, government can support platforms like the Nigeria Implementation Science Alliance and others that bring implementers and researchers together. It should not just be one-off conferences, but ongoing working groups on key issues, e.g. a maternal health evidence committee, a pandemic preparedness research coalition, etc., with government participation. Translational work often needs real-world data, hospital records, demographic data, etc. Government can facilitate this by improving data systems and granting researchers access to non-sensitive data for analysis. Also, streamlined ethical approval and research clearance processes, especially for multi-state studies, would help reducing bureaucratic delays means timely research, which is crucial if a policy window opens. Finally, government leaders must champion the value of research. We need our ministries, commissioners, and even legislators to speak about and demand evidence-based policy. Initiatives like including research outputs in the briefing of new officials or maintaining continuity of evidence-based programs across administrations are important. When a state governor sees that a pilot program reduced, say, school absenteeism by 30%, that program should be sustained and expanded, not shelved due to politics. A culture of valuing data and results has to be nurtured at the top. This includes accountability. Holding officials responsible for outcomes can drive them to seek research for solutions. Supervisors should encourage and allow students to pick thesis topics that address real problems, even if they are interdisciplinary or non-traditional. The age of siloed ivory tower research is past. For example, if a student in public health wants to evaluate a local health intervention, instead of doing a lab-based study, that should be supported, not seen as less rigorous. Lecturers can require that students think about the so what of their research. Perhaps as part of thesis defense, the students must present a one-page policy brief on an outreach plan for their findings. By doing this, we normalize that research is not complete until communicated to end users. Academic staff should leverage their networks to benefit translational goals. Many lecturers have connections with international collaborators or are part of professional bodies. They can bring in best practices on research translation from other contexts or facilitate student internships at organizations where their research can be applied. For example, a lecturer connected to WHO could help a student internship where they learn to turn research into guidelines. The academic community should advocate for institutional changes like those mentioned earlier in university roles. Often, it is the lecturers and professors who sit in Senate meetings or have the ears of the vice chancellors and policymakers. Use that influence to push for more support for research translation. If there's an opportunity to speak at the council or send input to a national education policy, stress the need for funding and systems that reward applied impact. Essentially, become activists for evidence-informed development. Senior academics who have successfully seen their research influence policy or practice should mentor younger colleagues in how to do the same. There are Nigerian examples to emulate. For instance, researchers from the Nigerian Academy of Science collaborating with Lagos State to train health managers in using evidence, the Preview Project, or professors who develop new technologies and obtain patents through university-industry collaboration. Sharing these stories in faculty forums can inspire others. When lecturers are enthusiastic and proactive about translational work, students will mirror that enthusiasm. In closing, I return to the fundamental idea that has underpinned this entire talk. Research has the power to transform nations. We have seen it across the world that countries that invested in translating research into practice lifted millions out of poverty, eliminated diseases, and built prosperous societies. Nigeria is brimming with intelligent minds, rich indigenous knowledge, and untapped innovations. By systematically linking those assets to our development agenda, we can achieve feats many thought impossible. The gap between where Nigeria is and where it aspires to be in health indicators, in education, in economic diversification, can be bridged by evidence-driven action. It is often said that one true path to socio-economic and technological advancement is through research and development. Indeed, nations that follow this path reap the rewards in growth and improved well-being. We must walk that path with urgency and purpose. The days of making policies based on guesswork or implementing programs by tradition must give way to an era of evidence-based practice as the norm. The motto going forward is simple: think globally, research locally, and act impactfully. As we conclude, I ask each of you to envision a Nigeria a decade from now, 2035. In that Nigeria, I see universities bustling with interdisciplinary teams, tackling local challenges, students working alongside policy officers as part of the training, government bodies routinely consulting research evidence before rolling out initiatives, and communities benefiting from homegrown innovations. I see maternal deaths plummeting because new solutions developed by Nigerian researchers, perhaps a locally produced low-cost device, the community health strategy, have been scaled nationally. I see our dependency on foreign solutions reduce as we export some of our own innovations. I see a research culture that has permeated governance so much that it's unthinkable to implement a project without piloting and evaluation. This is not a fantasy. It is entirely within reach if we commit to translational research as a national strategy. Let us move forward with hope and ambition. As I said earlier, you are the thinkers who must also become doers. Let's continue this dialogue beyond today, between lecture halls and government offices, between laboratories and communities. In that continued dialogue lies the sustained partnership that will yield public impact. I thank you all for your attention and engagement and for this opportunity to speak to you. Thank you.
Wow, this is massive. Let's give Prof a standing ovation. Please, if you're up there, let's stand. Those on video, you can stand. Please put on the chat box, thank you, Prof. Type standing ovation on the chat box so Prof can see you're giving him a standing ovation. Thank you very much, Prof.
Thank you.
Thank you very much, Professor Similai. I didn't expect anything less from you. In fact, we are completely mainstreaming. We are mainstreaming this presentation into our lecture materials. In fact, at the end of the whole thing, especially for our PhD students, we are going to make that available, and then we'll set some quiz a quiz, which they are expected to, of course, get the at least 50% before they'll be allowed to make progress. Thank you very much. We have noted a lot of those suggestions, and those suggestions will be implemented immediately because especially for the PhD, for our PhD students, they need to work on something that they can build their academic career upon. Thank you very much, sir. Thank you very much, sir. Thank you very much, sir.
Thank you.
We appreciate that. So we can sit down and then we can.
Please.
And please, I know you are on leave. You have earned it. You have earned it. Thank you very much.
Thank you, everybody. Thank you for the
opportunity. The recipient of the School of Public Health Gold Award. Thank you very much.
Thank you.
I think we'll take a short break now. Have a brief cultural display. I think we'll be bringing in some cultural truths from various parts of River State to entertain you before we move on to the other parts of the opening ceremony. Thank you very much.
Looking at civilian government, but then we following the month of the beginning. Then let's open up our time. Watch out with young girls. You love this group time. Thank you, young girls. All right, let's watch. And let me tell you, right?
You know that the masquerade is not a human being, but a visiting ancestor.
great joy and excitement as I welcome you all to the second edition of the Bonny Kingdom Boat Regatta competition. Today, as we gather once more, I'm filled with pride to see the growth of our beloved regatta. With 11 chieftaincy houses participating this year, up from 8 last year.
Today, as the waters of Bonny River sparkle under the sun, we celebrate not only the vibrant culture of our ancestors, but also the bond that unites us as one community. Bonny Boat Regatta is a sensory experience like no other. It is the sound of cheers echoing across the waters, the sight of vibrantly adorned boats racing in harmony.
The winners of today's competition is the Wilcox House.
As we envision the future of this event, we see immense potential. Our dream is to establish a cultural and tourist center right here in Bonny Kingdom.
Our first time for this boat to come out, I don't believe it. First time.
Thank you very much. I hope you enjoyed that. Thank you very much. I hope you enjoyed that. So the next item is the launching of the maiden edition of the official journal of the University of Port Harcourt School of Public Health, the Port Harcourt Journal of Public Health, and the West African Journal of Public Health. And we have a recorded video. So please, can we have that recorded video?
Launching of the maiden edition of the official journals of the University of Port Harcourt School of Public Health, Port Harcourt Journal of Public Health, and West African Journal of Public Health. The University of Port Harcourt requires postgraduate students to write and publish at least one research article on the findings of their research work. This key requirement has been difficult to meet because of the extra time it adds to the academic calendar and has made students an easy prey of predatory journals. To solve this problem, the School of Public Health hosts two academic journals, Port Harcourt Journal of Public Health and West African Journal of Public Health, to rapidly publish the peer-reviewed journal articles of students without compromising standard. The Port Harcourt Journal of Public Health is the academic journal of the School of Public Health, while the West African Journal of Public Health was established to publish the research studies carried out by international students in their countries. The journals also accept articles sent to them from outside the University of Port Harcourt School of Public Health. The journals are published online on the following websites: www.phjph.com and www.wajph.com. Launching of the
Okay. So the journal, the journal articles are online and they are freely accessible. You can go to the websites and view the various articles. Thank you very much. I think we can go to the next item, and that item is the presentation of the School of Public Health Special Awards. These awards we presented to individuals who contributed immensely to the establishment and the growth of the School of Public Health right from its inception in 2019. Please, let's have the video on of those presentations. Yes. Okay, we are going to start. The first on our list is the School of Public Health highest honor award, which we presented to the Vice Chancellor of the University, Professor Honorary Abraham Goodwill, for his contributions to the growth of the School of Public Health, as not only as the Vice Chancellor, but even before he became the Vice Chancellor of the University.
School of Public Health is proud to honor distinguished individuals who have played outstanding roles in the growth, resilience, and successes of the school. These awards are given not only to recognize excellence, but also to immortalize the sacrifices, vision, and dedication that brought us from where we began to where we are today. The School of Public Health proudly confers its highest award, the Platinum Award, on Honorary Abraham Goodwill, the 9th Vice Chancellor of the University of Port Harcourt. Professor Goodwill has distinguished himself as a leader who consistently places the interest of his alma mater above personal ambition. His unwavering support, protection, and encouragement have guided the School of Public Health through its most challenging seasons. A proud alumnus of the University of Port Harcourt, he graduated from medical school in 1990 and just 4 years later answered an urgent call to return as a lecturer in pharmacology, suspending his residency training in clinical medicine to strengthen the university at a critical moment. That selfless decision helped secure accreditation and set the tone for the ethos of excellence and service that continues to define the School of Public Health. As Vice Chancellor, Professor Goodwill's vision and courage were most evident during and after the COVID-19 pandemic, when the school transitioned into virtual learning. His leadership safeguarded the school's innovative academic reforms against opposition, ensuring that our programs not only survived but also thrived, reaching students across the globe. Today, the University of Port Harcourt School of Public Health salutes a disruptor, a reformer, and a defender of innovation, whose faith in the school has left an indelible mark. We proudly present the Platinum Award to Professor Honorary Abraham Goodwill, Medical Doctor, Professor of Pharmacology, Knight of St. Christopher, Chief in the Otaji Group of Houses of Abonima, and the 9th Vice Chancellor of the University of Port Harcourt. Congratulations, sir.
The Director of School of Public Health and other guests who are here, let me totally accept this kind gesture from the Director and this management team and staff of the School of Public Health. I accept it because I can say with all sincerity that the Director of School of Public Health has tremendously impacted on teaching and learning and research in the University of Port Harcourt via the School of Public Health. This is a director who has modified learning in a hybrid manner that allow people to study for our degrees, postgraduate degrees, masters, PhDs. Learning in a hybrid manner that allow people to study for our degrees, postgraduate degrees, masters, PhDs, no matter where you are in the world, it will assess you and be able to do what you're supposed to do. And occasionally you come down maybe to have some interactions and examinations and so on. This is something he has mastered in that school. And as a university, we are very proud of School of Public Health for what they do. Their teaching there is excellent. Their research is excellent. Their contribution to knowledge is so significant that I can assure you that the researches they have done there, both masters and PhD, has produced results that have shaped into public health policies. And so I received this award from the School of Public Health Director with very great joy. And all I can say is, please keep doing what you know doing well. Keep doing what you know doing best. Your name is even best. Keep being the best version of yourself. And please keep the flag of University of Port Harcourt flying. Thank you, and God bless the University of Port Harcourt.
Thank you very
much. Professor Iyopu Minakiri Siminalai, recipient of the University of Port Harcourt School of Public Health Gold Award. Professor Siminalai is a medical doctor, professor of pharmacology, former provost of the College of Health Sciences, and former deputy vice chancellor, research and development of the University of Port Harcourt. He is honored for his exemplary commitment to placing the interest of his alma mater above personal ambition, and for the steadfast support he offered during the formative years of the School of Public Health. An alumnus of the University of Port Harcourt Medical School, he graduated in 1991 and in 1994 returned as a lecturer in pharmacology, answering an urgent call for medically qualified teachers to secure accreditation. In doing so, he set aside his residency training in clinical medicine, a selfless act that reinforced the spirit of sacrifice and excellence that continues to define our school. His recognition today, however, is most strongly tied to his pivotal role as Provost of the College of Health Sciences. At the school's inception in 2019, it faced daunting challenges without offices, without lecture halls, and with opposition from entrenched interests. In those turbulent early years, Professor Siminalai brought wisdom, diplomacy, and goodwill that helped steady the school and chart a path forward. For his sacrifices, his mediation, and his unshakable loyalty to the University of Port Harcourt and its School of Public Health, we proudly confer upon him the Gold Award. Congratulations, Professor Iyopu Minakiri Siminalai, Medical Doctor and Professor of Pharmacology, Fellow of the Nigerian Academy of Medicine, philanthropist and medical missionary, recipient of the University of Port Harcourt School of Public Health Gold Award. Congratulations, sir.
I am glad. I'm truly glad and surprised that this has happened, And this award today, it's, I guess, a testament that hard work pays, right? I'm truly glad, and I'm grateful to the management of School of Public Health, particularly to Professor Digaha for this recognition. I am happy. Thank you.
Professor Arthur Nwafo Chumere, recipient of the University of Port Harcourt School of Public Health Gold Award. Professor Chumere is a professor of human physiology and biophysics and a former dean of the Faculty of Basic Medical Sciences of the University of Port Harcourt. He is honored for his outstanding contributions to the training of medical students and for the critical support he offered to the School of Public Health during its formative years. His life story is one of resilience and inspiration. As a child soldier during the Nigerian Civil War, he fought with such courage that he rose to the rank of Lance Corporal. After the war, he returned to complete his secondary education in Eleme, Rivers State, before proceeding abroad for undergraduate and postgraduate studies in human physiology on Rivers State and federal government scholarships at the University of London, the Wellcome Trust, and the University of Wales, Cardiff. In 1986, Professor Chumere was headhunted to join the young University of Port Harcourt Medical School as a lecturer in human physiology, and from then, he taught every set of medical students the university produced, known by his students as forthright, compassionate, soft-spoken, yet firm. He has left an enduring mark as a mentor and teacher. This award, however, recognizes most especially his role as Dean of Faculty of Basic Medical Sciences, where he used his office to provide essential resources to the newly established School of Public Health in 2019, a school then without administrative offices or lecture halls. His timely intervention was crucial in stabilizing the school at a very vulnerable stage. For his life of sacrifice, mentorship, and dedicated service to the University of Port Harcourt, we proudly present the Gold Award to Professor Arthur Nwafor Chumere, Professor of Human Physiology and Biophysics, Environmental Consultant, Church Elder, former child soldier, recipient of the University of Port Harcourt School of Public Health Gold Award. Congratulations, sir. Professor Daprim Samuel Ogaji, recipient of the University of Port Harcourt School of Public Health Gold Award. Professor Daprim Samuel Ogaji, medical doctor, Professor of Community Medicine and Health Systems Management, and Center Leader of ACE Putor, is awarded the Gold Award for leading the establishment and provision of the School of Public Health. A 1998 graduate of the University of Port Harcourt Medical School, Professor Ogaji earned specialist training in public health, an MSc in quality improvement, and a PhD in medicine. He also contributed internationally as a fellow of the International Society for Quality in Healthcare. His leadership ensured facilities and resources were secured for the school's successful start. Congratulations, Professor Daprim Samuel Ogaji, medical doctor and Professor of Community Medicine and Health Systems Management, Center Leader, ACE Putor, Fellow, International Society of Quality in Healthcare, Chartered Member, Nigerian Institute of Management, recipient of the School of Public Health Gold Award.
Just to thank you wholeheartedly for this. I don't take this for granted. This was a school that I believe was a dream at some point, but came into fruition, in the process of time. And the school has actually grown, in all ramifications. I'm so glad of that venture, and I want to also appreciate you for keeping the flag flying very high.
Thank you. Thank you. My HOD was my HOD, and I'm sure that he even played a crucial role towards my appointment as a director. Thank you very much, sir. Sorry. So on behalf of the School of Public Health, I present this award, the SPH Gold Award, to the Department of Preventive and Social Medicine of the university, and of course to the Department of Community Medicine of the University of Port Harcourt Teaching Hospital for their contributions towards the establishment of the School of Public Health. Thank you very much, ma'am. Thank you.
Thank you so much, School of Public Health, University of Port Harcourt. I received this on behalf of Preventive and Social Medicine Department, University of Port Harcourt, and Community Medicine Department, University of Port Harcourt Teaching Hospital, with a lot of joy, because I know how we started and we have grown in leaps and bounds. We have candidate students from all over the world, and I'm happy to be part of it. We are happy to be part of it. We sincerely thank the inaugural, the first director, Professor Best Odinyoha. He has championed this activity, this program so well. So we thank you. We are grateful unto you. We are grateful unto the Vice Chancellor. We are grateful unto the CMD University of Port Harcourt Teaching Hospital and the entire staff of PSM Department and Community Medicine Department.
Thank you, my HOD. Thank you. We appreciate.
Thank you.
Mrs. Maria Apogome, recipient of the University of Port Harcourt School of Public Health Gold Award. Mrs. Maria Apogome, Professor of Medical Parasitology and Environmental Biology, is awarded the Gold Award for for her excellent service during the school's formative years and for establishing student-friendly administrative protocols as the pioneer administrative secretary. The school, established in 2019 to meet World Bank ACE Pupil requirements, benefited from her expertise in synthesizing academic procedures from other institutions into a highly effective student-centric system. She also played a key role in navigating challenges, drawing on her experience and university connections. Congratulations, Mrs. Maria Apogome, Pioneer Administrative Secretary, School of Public Health, Institute Administrator, recipient of the School of Public Health Gold Award.
I want to thank the Director, School of Public Health, Professor Bess Odinoha, for this initiative to recognize my contribution to the School of Public Health. And I'm happy that his dream about the School of Public Health has actually been actualized, because from what I hear, public health is one of the best places in the University of Port Harcourt. Thank you, sir. And I also want to say that even the table I'm sitting down here today, it was Professor Best that bought the tables for this Faculty of Basic Clinical Sciences. So, sir, I want to say I appreciate all you have done for me. Thank you very much, sir.
Professor Faith Diogu, recipient of the University of Port Harcourt School of Public Health Special Recognition Award. Professor Diogu is a registered nurse and midwife and Nigeria's first professor of midwifery. She is honored for her pioneering contributions to postgraduate nursing education in Nigeria and as coordinator of the nursing programs of ACE Pupil at the University of Port Harcourt. Her journey began with undergraduate training in nursing and midwifery at the University of Ibadan. She later pursued postgraduate degrees in educational psychology, earning her master's and PhD at the University of Port Harcourt. She was then appointed a lecturer in nursing science, which inspired her to take a second master's degree in midwifery at the University of Nottingham, and later a PhD in midwifery from the University of Chester in the United Kingdom in 2017. In 2022, she attained a historic milestone, becoming Nigeria's first female professor of midwifery. As coordinator of ACE Pupil nursing programs, she championed the innovative online flipped classroom model of postgraduate education. This model created flexible learning opportunities for practical nurses, allowing tens of students across different specialties of nursing science to successfully train and graduate despite the challenges of full-time employment. For her groundbreaking innovations, her leadership in postgraduate nursing education, and her trailblazing role in midwifery, the School of Public Health proudly presents a special recognition award to Professor Faith Diogu, double master's degree holder, double doctorate degree holder, Nigeria's first doctorate degree holder in midwifery, Nigeria's first professor of midwifery, inventor of the upright birthing chair, recipient of the University of Port Harcourt School of Public Health Special Recognition Award. Congratulations, ma'am.
I feel so honored. I feel so elated. I feel so favored. This award means a lot to me because it shows me that as I'm working, some persons are acknowledging my efforts. So it is like a push for me to do more, because the one little one I have done is being acknowledged. That means more is required of me to do, and I'm ready, by God's grace, to do my best in this university.
Professor Florence Oyemachi Unduka, recipient of the University of Port Harcourt School of Public Health Gold Award. Professor Unduka is a professor of medical parasitology and environmental biology. She is honored for her exceptional leadership during the turbulent formative years of the school. As chairperson of the academic board of the University of Port Harcourt School of Public Health, she earned her doctorate in parasitology from the University of Nigeria in Nsukka at the age of 27 and began her academic career at Abia State University, Uturu, where she held several positions and left behind a record of remarkable achievements. In 2012, she transferred her service to the University of Port Harcourt, joining her husband, Professor Ethelbert Nduka, former Deputy Vice Chancellor Administration. Together, they formed a formidable academic duo whose presence positively influenced the fortunes of the School of Public Health. At its establishment in 2019, the school faced daunting opposition and administrative challenges. Professor Florence Nduka, drawing on her goodwill, diplomacy, and wide connections, played a pivotal role in navigating these challenges and helping the school to find stability and growth. For her steadfast leadership, courage, and invaluable service to the School of Public Health, we proudly confer on her the Gold Award. Congratulations, Professor Florence Onyemachi Nduka, Professor of Medical Parasitology and Environmental Biology, Fellow of the Parasitology and Public Health Society of Nigeria, Neoha of Ibim Ohafia, recipient of the University of Port Harcourt School of Public Health Gold Award. Congratulations, Ma.
Thank you. This is so beautiful and unexpected, really. When we work in a manner that just to add value, not really expecting anything in return, but not to say that I don't appreciate this. This is really appreciated and certainly will motivate one to do more. Thank you.
Thank you. Okay. Thank you very much. I think we have
fading away like the stars. The Heralds, recipient of the University of Port Harcourt School of Public Health Ignominy Award. During the school's early years, some key university functionaries called the Heralds after the biblical king saw the school's potential but actively worked to frustrate its success. They are collectively awarded the Ignominy Award to immortalize their ignoble actions. The School of Public Health, established in 2019 to support World Bank-funded ACE Quito goals, inherited adversaries who withheld administrative support and resources, making early years extremely turbulent. The Ignominy Award serves as a lasting reminder that actions, especially in power, are remembered. The prize money will fund a plaque in the school's toilets as a fitting memorial.
Only the truth that in life we have spoken, only the seeds that in life we have sown, these shall pass onwards when we are forgotten. Only remembered.
Okay, we congratulate all the recipients of the SPH award. We have one additional one to present in person, and we will be presenting the SPH award to Speedlink, our service provider, for their speedy and courteous services in line with the school mantra of treating students as clients. And we will be presenting the person to receive the award on behalf of Speedlink is the MD CEO, Daniel Okon. Daniel, I am presenting this award on behalf of the School of Public Health to you for the courteous service. In fact, you are the one that transitioned us to online virtual learning. Thank you very much for all your services. And of course, for the speedy and courteous services, even as the number of students ballooned to a few thousands in a yes. You still remained courteous, and then you speedily respond to all the queries of the students. Thank you very much, sir. Thank you. You have any comment on me?
Thank you very much, Prof. Thank you very much, our Vice Chancellor, for first of all giving me the opportunity to be with the School of Public Health. Actually, this started in COVID-19, Prof, right? 2020. 2020, that's when we started this. And Prof actually told us that he needed SPH to be number one in Nigeria and Africa. And of course, we had work to do. And we are just glad that today, SPH is number one in virtual learning, virtual administration. When we talk about online learning and online schooling, SPH is always a reference point, and we are glad to be associated with the School of Public Health under the able leadership of our Prof, Professor Best, and the Vice Chancellor. Thank you very much, sir. Thank you.
Thank you very much, Daniel Okon, for the excellent services. I think the next is vote of thanks. Anyway, you have been wonderful. I think we have to thank the Vice Chancellor for being one of the first to log in, even before the advertised start time of 10 a.m. I hold him in very high esteem, personally, and as director of the School of Public Health. I thank him so much. If not for him, we wouldn't have achieved what we have achieved. If not for him, we wouldn't have achieved. In fact, as he's completing his tenure as a VC, it means that the School of Public Health we have to learn how to probably work under a different VC. We just pray that that VC will not only borrow a leaf from him, but probably the whole exercise book, and continue to support the School of Public Health. Thank you very much, sir. Thank you for all the encouragement. Thank you for all the support. Thank you for all the shield. I talk about shield, and I talk about defense, and I talk about everything, because it could have been very, very impossible, especially because we have some conservatives within the university that made life very difficult. And if not for a person like him, we wouldn't have succeeded. Thank you very much. And I actually call him both my Lord spiritual and temporal, because it's not just our boss in temporal matters. It's also our boss in spiritual matters, because he guides us in our spiritual life. Thank you very much for those early morning messages. Then I have to also thank the chairman of the day, Professor Chima Nwabunwa, has been a role model, was a senior colleague right from the medical school days. Thank you very much for all these efforts, for the efforts you made to take part in this opening ceremony. And then for our keynote speaker, Professor Iyopu Similaye, the recipient of the School of Public Health Good Award, for his wonderful lecture, which we have anyway permission. If he gives us the permission, we are going to host it on our website, and we'll have to make sure that all, especially our PhD students, will have to pass the quiz that will emanate from today's lecture. Thank you very much. And even beyond that, he, especially as the DVC R&D, he actually also guided us, protected us, And even when we were going astray, he was the mediator. He was the mediator that solved or helped in the amicable settlement of some of the issues that we had in the School of Public Health. Thank you very much, Professor Similaye. And I have to also thank the TVCs, who are incidentally my colleagues in the medical school, Professor Rosemary Ogu, the indefatigable former president of the Medical Women Association, perhaps the most powerful medical association within the health profession in Nigeria. Thank you very much, Professor Ogu. Thank you very much, my immediate provost, Professor, and now the DVC R&D, Professor Angela Frank Briggs. Thank you very much, Ma, for all your encouragement, even as the provost of the School of, of the College of Health Sciences. And then I have to also thank the provost, the current acting provost of our wonderful college, Professor Ngozi Ekeke. Wonderful guy. Thank you very much for all the support, for all the encouragement. Thank you very much, Professor Ekeke. Then my dean, Professor Akpa, he sent in his Goodwill message. We didn't have enough time to read that. Then my HOD, Professor Madoka, Professor Gaji, very wonderful. In fact, should I call him the midwife of the School of Public Health? And he not only the midwife, but even the person that battered the School of Public Health. He carried the pregnancy and even took part in the delivery. So he was both the pregnant woman and the person that took the delivery. Thank you very much, Ogachi, as I used to call him. Thank you very much. And then I think I forgot my able deputy director, Professor Charles Tobin West, an elder of my department, an elder of my department, cool and very, 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 very helpful. Maybe very on the quiet side, not us, not like some of us, but he has been very, very wonderful throughout. Professor Tommy West, thank you very much for everything. Then, of course, the lecturers, and the supervisors from all over the country, all over the world, including those in Ghana. Thank you very much for what you do and what you are doing. Our students, thank you very much. Yeah, and of course, our guest speakers who will be coming later in the program to make their presentations. Let me thank you in advance. Thank you very much. And the management of the university, and it seems I just nearly forgot the graduate school, ably led by Professor Anele Kinikamwanlele. Wonderful guy, very supportive, very, very supportive. In fact, let me not say it, because I used to have post-traumatic stress disorder. Yes, flashbacks anytime I visit the graduate school, but he has been very reassuring, very, very reassuring, very, very reassuring. So I thank him very, very much. And of course, his assistant, Professor Buchi, and the GSO, Mrs. Yagba, who used to be a member of the University of Port Harcourt Governing Council, and the service providers. I must continue to thank them, because the capacity, the ability to deliver, probably rests almost squarely on them. Daniel Okon and the Speed Link, and then Chima Woke, our web designer, and of course Chisom Joku for his roles, especially in the plagiarism and the communication aspects of the School of Public Health, our technical officers, our technical staff, Marvelous, and others, and then the wonderful admin staff, heavily led by the admin officer, Mrs. Sorry, yes, thank you very, Alorichi. Thank you very much. I think I have to thank her for being very, very supportive, very, very supportive, very, very supportive. And then, of course, all the past admin secretaries of the School of Public Health, starting with Mrs. Maria Kogome and Mrs. Charity Zeronem. We have to appreciate them and thank them for their efforts. And then everybody, we have to also thank God. Hopefully, anyway, I'm almost exhausted and I'm just hanging on to see, to get to the end of the administration of my able vice chancellor. So I have to thank everybody that assisted all of us, assisted us in the School of Public Health, from the single office in the teaching hospital to what we currently have now. I thank you all, and of course thank God for the enablement to do all these things, because he's the one that strengthens us. We can do nothing except him, and we have to return all the glory to him. Thank you very much. Thank you. I don't know if Professor Onwabunwa is still around. He's still on call for his closing remark. I know he once said that he had a flight to catch. I don't know if he has probably is on board. So on that note, we have to end today's section. Not today's opening ceremony, because we have an afternoon section in which we'll be taking the presentations of the abstracts that have been sent in. Sorry. Oh, Professor Onwabunwa. Okay.
Yes,
Hello,
thank you. The host put me on hold for a while, but
I'm
waiting to board my flight, but I'm glad I had the opportunity to stay till the end. And again, not to repeat what you have just said, we are very grateful. We are very proud of you, Director, and your team. We are very impressed with the achievement of the School of Public Health. It has been very, very, very clearly elucidated by all the speakers. And we trust, like I had indicated earlier, that this would not be the end. This would be a beginning of a new era. With the new regime coming, with the new Vice Chancellor, I want to assure you that what is good is good. Everybody wants the progress of the university and the institutions. And we don't know who the new Vice Chancellor will be, but one thing we know is that this is unique Uniport, and we have set the mark of excellence, and that will not be compromised. And we trust that we will bring everything we have on board to support the new incoming administration to build on what has been already achieved. We also want to promise you that we've been part of the team from the beginning, and we will continue to support the team and look at additional growth and tentacles that will spring from this place. We want to reassure our students that you are the best materials, you have been trained by the best hands, and you are a global material, and you can perform in all stages. So we want you to be confident even as you present your work today. And in the subsequent opportunities that may come. And finally, please try and publish. Having presented these materials today, we will look forward to a number of publications coming through this. And we, the faculty and the rest of us, even those who are not on ground, are here and willing to provide mentorship and support and partnership for those who have graduated. You have become colleagues, and we'll work together to continue to move Unipop forward. Please remember your alma mater. Thank you. God bless. Bye.
Thank you, Mr. Chairman. I think on that note, we'll start the closing formalities. Please just note that we'll have a scientific section starting from 4 p.m. today, where our presenters, those that have sent in their abstracts, will make their presentations. Thank you very much. I don't know. I think we can, those online, we can only serve you virtual refreshments. But if you are somewhere around, we have one or two. We have small refreshment for you. So if you can step into our liaison office in at the teaching hospital, or our main administrative office in the university, at least you can have something to drink. Thank you very much. And then for those who are registered for the conference, we have, should I call it a lecture material? Okay, so apart from all the presentations will be made available to you. And then, but we also have one or two conference material, a jotter, a biro, and a few other things for you. Anyway, so those of you that are around, we can make that available, but I don't think it will be cost effective for you to travel down from Ghana or from northern Nigeria, Duse, and Kano and Maiduguri to just come to pick the jotter and the pen. But when you visit, anytime you visit the University of Port Harcourt, you can be assured that you can collect these conference materials. So thank you very much, and thank you for your participation. So we will close this opening ceremony and then reconvene by 4 p.m. when we'll be taking the abstract presentations. Thank you.
We'll close with the school anthem, as our culture is.
Close with both the university item followed by the national item. University item, please.
Who have played outstanding roles in the growth, resilience,
University item. Can you?
When the green lowlands and swampy plains of the New Calabar River stands, the University of Nigeria, we hail thee, our own. Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. Oh God of all creation, grant this our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Thank you very much. We are going to continue by 4 p.m. with the presentation of abstracts for day one. For day one, yes.
Please, for our records purpose, can you turn on your video so we'll just take a virtual photograph, just like we would have done if it's in a physical event. So please, if you can, turn on your video so we can take a photograph for our records. Thank you very much. Yeah. Let's just give 3-4 seconds. So please turn on your videos so we can stream. All right. So smile like you're in a physical conference so we can take the pictures. Thank you, student. Thank you. Next slide. Thank you. The next slide. Right, the next. All right. Okay. Thank you very much. All right, that's final slide. Thank you very much. God bless.